What is happening in this world is far different than they are approaching it. So, without further ado, Dr. Nasr, come and tell these people what they really ought to know.
Okay, thank you very much. Thanks. Let me just put this stuff here, and I have Bieber, and I have this. Oh, looks like a CIA agent or something. I'm not obese, but the belt is tight. That's the excuse. Okay. Can you hear me in the back? Can you hear? Okay. We're going to say good evening and thank you for coming tonight. And for the people who are here for the first time, you asked a question about the series, with this. I've been lecturing for 26 years. I lectured to over 3 million people. And most of my lectures for the last 26 years was on preventive medicine, pollution, stress, stuff like that. And the story she said about medical school, that's a true story, because when I started in California with all the nutritionists, the first ones, Linus Pauling and all of these people all started forming a nutrition group, the National Health Federation, and Sierra Club, and all these institutions that were fighting pollution and recycling and all of that. We found a tremendous resistance from the industry and the blockage against anything you say, to the point that if we have a meeting to speak on vitamins in Pasadena, for example, the first lecture was in a house, 3 people and me taking lecture on vitamins. Everybody has to be in secret because you get accused of misleading the public all the time. Anything you say, those days you're a communist. So anything you want to do different, they say you're communist. If you say anything against what I call the politicians, I call them thugs, because they're thieves and they're just nothing but interested in themselves. All of them are. They all interested in themselves. When you see nobody really goes on TV and talk about what's good for the environment, what's good for the people, what's good for that. Nobody's saying anything like that. But you see ads all the time about beer, about alcohol, about cigarettes, about this, about that, about this. But nobody's coming to say that these drugs over the counter are killing lots of people. Nobody's coming to say that the hormones in milk and all of that can cause cancer and all of that. Nobody's saying anything about it. All they say, we are the experts, we know everything, and then nobody knows. So anybody comes to you, they have to shut that person. Then they would say to me, well, you just have finish your PhD, what do you know about medicine, So I had to go to get a medical degree to be able to speak. And after that, you're just a general practitioner. Then I have to go get an internal medicine degree so I can get accused. Seriously, that was the reason, because I did not need the money or to get a degree to stay here. I didn't come here as an immigrant, really. I was immigrated here, but there was war reasons that I don't want to go to the war there, that I was here. It was not because I want to be here. I'm doing research in Cairo for United Nations and nutrition and arteriosclerosis and vitamins, and all of a sudden wars all over us, and then my building gets hit by missiles and all of this, and I just got so sick of it. My dad said, well, we're all just going to leave, because most of us are scientists, my brothers and all of us in research. So we just decided that it's not our style of life to be in this environment, because our family were more academic life. So when I saw that, I couldn't go back, of course, because you go back, you go to the army. So I had to do something here, and then I started, giving knowledge, because my biggest surprise of all when I came here, when I landed in New York airport, and I saw ad on TV saying this product cures arthritis And then I was doing research on nutrition, and I thought there was a nutrient they're talking about, because I studied biochemistry. It was enzyme they're talking about. And as a chemist, I said, that doesn't cure arthritis. This is a lie. And here is the first time I was shocked to see a lie in the United States. They lie to the people? It can be. It's impossible. Because I wasn't told there in Egypt. I was told everything is, perfect. There is no problem at all. By the embassy, that we have everything is right, And then I saw that and I said, I think we are just like human all over the world, the good and bad here too. So anyway, I started saying, okay, I better speak about, I better talk about it and say this thing. So anyway, I lectured a lot, and Joyce sponsored this series of lectures for many, many years. And we decided, she and me, over the phone, I just want to make it clear one thing. I do not come here to get paid for giving lecture, okay? I don't get paid to give the lecture. And besides, I come here also to recruit patients because my clinic is very busy. I came here too really because I want to be here, because that is the only area I love to give lectures to, this area right here, because most of the people respond very well to nutrition, and they accept it, and they apply it to their life, more than other areas. Like Chicago, I wouldn't go to downtown Chicago to give a lecture, because they're going to come to the lecture, they go out, I see them all sitting in the bars after the lecture. So why should I go to give a lecture to people who don't practice what I just told them? I saw that, so I said, no, I don't want to come over there. This lecture on hormones then was part of a discussion. We decided we should address this subject because I do so much research in my clinic on something. Like, for example, for the last 15 years, I've been working on female hormones. And then for the last 5 years, I've been working on male hormones. So I find things. Of course, I use literatures, I use magazines, I use papers published, I use anything available, but many times I am a pioneer also. I develop my own technique, my own theory, my own method, and I talk to my patient, I use it that way. I'm one of the first people treated PMS with primrose oil when PMS starts being a symptom. One of the first people who came out that even primrose oil has progesterone. So this lecture is really designed. I had a difficult time how many lectures I need, how much time do I need for those lectures. So I would decide on 3. So when I started speaking, I said, should I speak on female hormone or male hormone, or just give people idea of what's a hormone? Then that's what we did last lecture. I just said, okay, what's a hormone? What does a hormone do in the body? Just for a child, for a man or a woman, adult, everything, That was a very good lecture, I thought. It was covered really deep how the hormones work in general. Then specifically tonight we're going to speak about female hormones. And then next lecture, male hormones. But I'm not going to guarantee you that I can cover every single female hormone tonight, because I was just looking at the stuff I write myself. How many hormones are they that I have to cover for women? There are about 60 right here, different hormones I have to speak about. I can't speak on 60 hormones. There are hormones coming out of hypothalamus. There are hormones coming from anterior pituitary gland, posterior pituitary gland, from the adrenal, from adrenal medulla, cortex, thyroid, parathyroid. There are hormones from the ovaries, from the testicle, pancreas, kidneys. There are hormones from the stomach, different parts, from the liver, from the thymus, pineal gland, placenta, heart, and white blood cells, and every place. So hormones are coming from every direction. You only hear a little bit here and there. So for the sake of just the new people who are here, I just like to give you some idea about hormones so you can catch with us and you're not lost behind. Basically, the human body made, that's a woman in front of us right here, let's assume this is one, made from organs, and the organs are called the vital organs. A vital organ is an organ that makes something for you. Non-vital organ, that's an organ that It protects you. It does not really, like for example, the knees are not vital organs. They're not necessary for life. The hips are not vital organs. But the bone marrow inside the bone is a vital organ. You follow me or no? Because without it we die. But without a knee we don't die. So this is a vital organ, not because the joint itself, is because what's inside the bone marrow itself is what's vital to us. You follow me? That is what we need. That's the defense system inside right there. This bone is made of cells. And those cells, the bone marrow, or the bone itself, require nutrients to produce whatever they produce. They produce red blood cells, white blood cells, and platelets, and all of these things, correct? So if the bone does not get the nutrients, it's not going to produce the red blood cells. So what will happen to that person? Will have anemia, will be tired and fatigued, and doesn't have energy. If it doesn't have enough white blood cells, what happens to that person? He cannot defend himself against cold, against cancer, against stress, all with allergies. Something is wrong because the defense is not there. That comes from the bone marrow. If you really study the human body, it's so simple. God put a big miracle here. We don't know everything, but we know a lot now than we did 10 years ago. And we continue. We thank God for that He gives us more knowledge and more knowledge to improve the quality of our life all the time. So we can worship Him better. Because you can't worship God when you are in trouble shape, If you are all in pain and all of that, you don't appreciate it. But if you are feeling good, that's the time you have to say, thank you for making me feel good. So He gives us knowledge so we can feel good and look good so we can thank Him more. So in any way, this is the way the body works. Cells, they get nutrients, they produce stuff out, and those cells have chemicals inside it produced that has to come out with antioxidants, and we're not going to cover this subject at all. Why do we need for supplements? That's a different topic. So for these nutrients to enter the bone, they require hormones. To enter the bone, they require hormones. You remember I said the word hormones, I didn't say which hormone. Because if I'm going to specify, then we're going to be in trouble. There's so many of them. But I will concentrate on few hormones tonight. I'm going to speak about thyroid. I'm going to speak about estrogen, about progesterone, about testosterone, and cortisol. I'll be giving comments about the DHEA and about other things like there are people having questions about the magnets you use at night to help them to feel good. Some people using colloidal minerals, and basically these are a very serious approach to health. To take DHEA is a very serious approach, and to use magnets. I would say that I wouldn't use it personally because that's radioactive substance, magnets. The power lines when they go over your house, they cause magnetic field, and we know that the television causes magnetic field. If you go close to your hair stands, right? So imagine somebody putting a magnet on their body all night. We don't know. We don't have enough research. Is this person can develop cancer or not? I cannot really make comment. All I say, there's no research been done on that subject, and I'm not going to use it. So the people who use magnets, you can use it if you're making it feel good, but I'm going to warn you, we don't have enough information on how much this radiation in terms of the magnets cause inside the body. How much they're going to affect and disturb the white blood cells and the red blood cells, we don't know. How much they can affect the feed rate inside the body and circulation, we don't know. So there is a possibility they can cause cancer, they can cause harm. The other one is colloidal minerals. Anytime you give a mineral, you have to give it in solid, not in liquid. Any mineral in liquid form, it can become toxic because minerals, they should not be given in a colloidal form. They should be, you see, when God created minerals, always created in a solid matter, never a liquid matter. He created sugar like orange juice and apple juice in liquid, but not solid. You don't see calcium in liquid. You don't see potassium in liquid, always solid, because chemistry-wise, they deteriorate too fast with light and temperature. Regarding the DHEA, let's take care of that right away before we start the lecture. Like any other hormone, DHEA is a hormone, and we have about 60 hormones. And those 60 hormones I talked about, I say, any of these hormones I said right here, whatever hormone, if I give it to anybody between the age of 15 to the age of 100, they feel good. Any of these hormones. Even you don't need it, you still feel good. You follow me or not? Only for a short time, if you don't need it. Then you start having side effects from it. You start having problems from it. You understand? Remember that athletes who use steroids, which is a hormone, natural hormone, they have problems from it. Correct or no? DHA is a steroid hormone. Do we need it in the body? Yes, we do. We produce in DHA. We produce our own DHA. But we cannot take the hormone from outside. We only take hormones. Remember this word right now tonight. You only take hormones if a blood test is done about that specific hormone, proves that you are deficient in, and follow-up every 2 months has to be done, or 6 months the rest of your life. You understand or not? I want to make it clear before we talk about the benefit, the great benefits of hormones and nutrition tonight, the danger of hormones. The hormones are double-edged swords. If they're too low, they destroy your life. If they're too high, they destroy your life. You follow me? Just like anything else, blood sugar. Sugar. You need sugar in the blood. If it's too low, you don't feel good. If it's too high, you have diabetes. Anything, name it. Potassium. Some of you are probably medical technicians or nurses. When it's too low, people feel terrible, right? When it's too high, they die. That's how we do heart surgery. We inject the potassium in the heart to stop it. Then we work on the heart, and then we shock it comes back. We inject calcium to bring it back. So the potassium, that's a mineral. But mineral and all the nutrients, they have limits, high and low, and there is a range. They have to stay within. So please do not take chances, and any subject, anything in the market sold for money, you're always going to find a doctor who explains why you should take it. Even if somebody put dirt in capsules or sand in capsules and sell it, you will find a doctor paid enough money to say sand is good for you or dirt is good for you. And he gives you every reason in the world. There are doctors who said cigarettes is good for you. There are doctors who used to say alcohol is good for you. They still do. There are doctors who say a little bit of that is good for you. A little bit of wine is good for you. You know, it depends on how he was raised and what he practiced in his own life. That's his understanding. So hormones are double-edged sword, but we need to be careful. When they are low, we have terrible problems from them. When they are too high, they can give us problems also. We don't see too high hormones. The only hormones we see too high of it are the people who take it on their own. Because very seldom I see women with high hormones. They're always low. They always want everything. But high, no, we don't see high hormones. We see high among the people who take in on their own stuff. And those people, they feel good? Yes, they do. For how long? Probably about 6 months or a year after that. The same thing with melatonin. I am surprised there is no question here to talk about it a little bit. Because melatonin became a big thing, and you have books written on melatonin. It is true. Melatonin is one of the hormones. You take it, you're going to feel good. For how long you're going to feel good? Cocaine is a hormone. Okay? Cocaine itself is a hormone. Marijuana is a hormone. Nicotine is works like a hormone. So does this mean we should take nicotine and cocaine and caffeine and all of that because they make us feel good? You ask a drug addict, why you take it? What does it tell you? He said, I feel good, right? Feeling, it doesn't mean it's healthy. You feel good about something, it doesn't mean it's good for you. That's for children especially. You tell him eat salad, he said he doesn't want it. So it's good for him, but he doesn't like it. It's good for him, but because he is convinced salad is not good for him. It's a cheeseburger and pizza and stuff like that was good for them because the TV and school, that's all they taught him how. How the child turn out to be like this? Because somebody taught him that. Who taught him that? You didn't. It's the TV. Because TV and his friends, and they are more teachers to kids than us. They control their brain more. They just stare at TV all the time, and whatever message comes, it goes in and stays in. So that's a very dangerous life to live in, to fight with something like a TV. So this is why I say to the people who are in the TV industry and all of that, which they never listen anyway, in newspapers, you are responsible people for millions of people. When you put a message across, put a good message, not a bad message. But they get paid enough to put whatever people want. This person here, he has skin. We make it green because maybe it's a Martian. Okay. And the skin is made also of cells. What's the function of the skin? The skin is the most important organ in the world. Because according to skin, you classify people. According to skin, you classify man from woman, young from old, black from white, according to skin. And believe it or not, within the same race, you classify according to skin. You not only black and white, even among the white. They tell you are young black, white, you are older white, you are middle white, you have to retire, you have to go, because according to your skin, right? People look at you and judge you according to the outside. Nobody is looking to the inside. And one of the biggest surprises when I came here to this country, coming from Egypt, the country's been around since Adam, since 10,000 years, and living in a village that the tombs around the village is 7,000, 8,000 years old, pots and pans and all of this thing around you when you play as a kid. You adapt to these ancestor cultures, and you know how they survived and how they work with the environment, how they mix themselves with the nature, not to fight nature. And when I come here, we are the same thing, because where you came from? We came from Europe, and Europe came from someplace else, so everybody is related to everybody, if you look at the world anyway. You know, it has to be. Adam to Noah to this to this. We have to be all related to each other, but we migrated in different directions. When we look at the people there, we find them, they have a custom or a habit that the older a person gets, the higher position in education and society they get. The older they get, the more experience they have in a job, the more money they have. They keep them until they drop dead. There's no such thing called retirement at all. And they get less responsibility, physical, and more mental responsibility. You know, and that's the way. And when I come here, I find the opposite. The biggest brains in the country being retired, then the new ones take their place. And that's a mistake. That's a tons of experience we get rid of. And the younger you are, the worse you are. The older you are, the better you are. Life comes with experience. And good and bad, and you evaluate yourself and you improve yourself all the time. So the skin become a big factor that people start making themselves look different to satisfy everybody else, not themselves. Because when you are alone in the house, you do not wear makeup, you don't change yourself. But once somebody comes in, you immediately have to take a shower, you have to put makeup, you have to put that mask, so nobody can say anything bad. Wouldn't it be better to be like I was raised in a village in Egypt, that when women and men wake up in the morning to go to the field together, nobody is putting makeup and everybody loving everybody, marrying everybody the way they are. There is no, why? Why they're getting married? Apparently they have lots of kids, they must be getting married. So they have, what attracts them to each other? Without beautiful clothes and cars and makeup, what did attract them? Because the basic knowledge they have in life is different. The concept of man and woman relationship is different. They look at each other as partners, together. You know, they work under God together. There's no nothing called you look ugly or you look this or look this. They always evaluate themselves with spirituality or inside. I noticed that. They work together in the field. They work together this. They work, the Western world, they try to say these people in the Amazon, these people in India, this Africa and all of that, they have nothing good about them. They are inferior, they are this, they deserve to be killed, they deserve to this. That's not true. It is true they are dirty in lots of things. They're not, hygiene is not very good, and we can teach them that. But they have a lot of qualities we can learn from them also. You follow me or no? The family relation, the foundation, the medicine, the healing, the way they act, you see, you appreciate it when you observe them as a family together. You can appreciate that. This is something I found we losing ground right here. So the skin is important to stay healthy, and hormones help the skin to stay healthy in women. We will talk about that later. Inside this body, in front of you, there are other organs. One organ here, like I always say, some people don't have, and that organ is made of cells. The reason I said some people don't have, because during my practice, seeing 20,000 patients, there are people, I talk to them for hour and hour and hour to take good care of themselves, to take vitamins, take minerals, to take exercise, not to drink. They just blank. They don't have it. So I shake their head to see if I can hear a brain or something like that, and I hear rattling inside. I figure there is a little brain, but it's not enough to think. So anyway, that's all the people need lots of lecithin. So we we have a brain cell right here that has function. What's the function of the brain? You know very well that without the brain, we're not human. Correct? Once you have a stroke, once you lose your memory, you're no longer a human. You're an animal. Have you seen anybody who your friend you communicate very nicely with, all of a sudden they have Alzheimer's, and then you try to tell them something, they don't remember anything. They don't. Have you seen that? Since you feel bad about the condition of this person, how does he feel about himself? Helpless, right? You tell him right is right, left to left, like a baby, like a child. And that's a person that have done a lot to help other people all his life. So it makes me break my heart to see these people. And I did lots of research on Alzheimer's, and we finally have a breakthrough right now that we can actually prevent it. And actually, we working right now try to cure about 80% of Alzheimer's patients. Right now, that's what we've been working for the last 12 weeks. So the brain have specific functions that we cannot lose it. One is the memory. You remember something. Another one is intellectual. You can judge something. The third is balance, that you're not dizzy, you're not lightheaded. And the fourth, control the body functions. And the fifth, sensations, the pain and all of these things. So the body, the brain has lots of cells. If you lose one of them, the vision, then your life will change. The hearing, then your life will change. The balance, then your life will change. You know, if you get dizzy, and all of a sudden your life will change. So you appreciate the brain when you start losing the function of that brain. And there are lots of them. All the brain functions controlled also by hormones. Nutrition goes to hormone, goes inside the cell. The cell using it, does what it does, and produces waste. The antioxidant comes in, takes it out, and the brain continues. This is why we see some people, age of 100, they're very sharp. Another, age of 60, they have Alzheimer's. What's the difference between the two? The difference, one has better hormones, better nutrition, better thinking ability than the others. Inside this body, there are other organs also. One right here is the lung. made of cells. It brings oxygen inside, gets rid of carbon dioxide. It's important to have, you don't know how many patients actually, probably 50% of the patient I see, when I check their lung, I found they're not getting enough oxygen. And that's a big percentage. They look fine in front of me. They sound fine. When I put them in the breathing machine to measure how much the vital capacity and all of that, I surprised myself that he's not getting enough oxygen. And this is something, hormones also has some function in that. The digestive system, the stomach, the esophagus, the pancreas, the liver, made of also cells, also controlled by hormones. And in the back, right here, we have two kidneys, also made of cells. They're also vital organs. Very important also, they have hormonal function inside them. So, to control this body to make it work, the food will come in from outside, supposedly, right here, with the essential nutrients that we talked about in many lectures, which are the following. I'm repeating it for the new people, which are the protein, the carbohydrate, the fat, the vitamins, the water, the mineral, and the oxygen, and fibers. This is all the nutrients you need. You don't need DHA. You don't need melatonin. You didn't see me write anything else right here. No colloidal minerals, none of that stuff. I wrote protein, carbohydrate, and fat. Vitamins, water, mineral, oxygen, and fibers. You give that to man, or a woman, or an animal, or any creature. That's all the nutrients they need. They don't need drugs. They don't need alcohol. They don't need DHA. They don't need anything else from outside. With those, right here, you can do anything you want. So these are the nutrients. They go inside the stomach. They get digested. They go absorbed. They go right here to the liver. They go from there to an organ called the heart. And the heart will pump it to the brain so the brain can get the nutrients it wants. It will bump it to the bone so the bone gets what it wants, and so on and so on. You follow me? It's all over the body right here. The circulation's all over. This is the circle of life right here. This is controlled by certain things. The glands in the brain, the first gland right here, we should make another picture. In the brain, we find a gland right here called the hypothalamus. That's the mother gland. And that mother gland, its function is control your daily life. In the early morning, at 4 o'clock in the morning, it wakes up. At 4 o'clock in the evening, it goes to sleep. That's in the human race. In women, it functions different from men. Women have a double hormone. Men have a single hormone. Women have double functions. They have to produce hormones to sustain life for themselves. They have to produce hormones to produce a new life inside them. You follow me or no? So that makes it very difficult to have a machine that does dual function. A function to stay like a man, and a function to be ready to have a baby. But you can say, well, I'm 50, I'm not going to have a child. No, those hormones for having a child are still there. They're still with you all your life until you die as a woman. Even if you don't have a child, still, if you are 80 years of age, a woman, or 90 years of age, and when you take a fetus from a woman, implant it in your uterus, you will produce that baby, you will feed him until he grows and will take him out of you. Did you know that or not? A woman, not a man of course, I hope not. A woman is able to carry her daughter, child, in her womb at the age of 60 or 70 or 80. If it's implanted inside the uterus and given the right hormone, she will sustain him until he's delivered. Even herself, she cannot pregnant, she can produce life. You follow me or no? And that probably will give us an idea why the Prophet Ibrahim, why his wife, Sarah, got pregnant when she was pretty old. It's so easy for God to do that. All he has to do, produce some hormones, and there's no problem then. And that's what he did. He reversed the cycle, and he made her younger. So it is possible. Everything, so getting younger, it's possible because God showed us in life that. In books, showed us. In history, it showed us. In front of us, we can see people for the age of 90, they feel like 50, and people 50 feels like 90. We see that. So it is possible. It is possible. We see it in my practice. Somebody feels like 100 when he's young, and then they come in after 3 months, they feel so beautiful, so great. So human body controls itself by the hypothalamus. It secretes hormones to two glands, one and the other. This is called the pituitary gland, the anterior pituitary and the posterior pituitary gland. The anterior, because the reason I say the anterior, because if your head like this, your nose like this, this will be the anterior, your eye like this, and this the posterior, your back. So they sit behind the eye right here, one behind the other. That's why we do surgery on pituitary through this area here, because that's the easiest way to approach it right away if it has a tumor. It's just behind this bone right here in the back. So these, they sit in a piece of bone. They're called the turkey saddle. They look like camel saddle, and they sit in those pockets. And those hormones also, they get the message at 4 o'clock in the morning. The mother gland wakes up and sends an alarm clock to the anterior and the posterior, tell them wake up. Then they wake up at 4 o'clock, and when they wake up, they start sending hormones through the body. They send messages through the body. Amazing, beautiful system. What do they send? Everything. They send hormone to stimulate the thyroid gland, hormone to stimulate the parathyroid gland, hormone to stimulate the adrenal gland, ACTH, and so on, so on. So hormone to stimulate the ovary, hormone to stimulate the ovary, another one. And keep going on. And the back of the posterior is different. It secretes dopamine to make you feel great, for feeling. And then it secretes oxytocin to make the uterus contract, to get rid of any cancer or chemicals inside it. And then it secretes ADH right here to control your blood pressure so you don't get dizzy or lightheaded all day. So this type of, when they wake up in the morning and secrete that, then all of a sudden when you sleep, you get this rushing of hormones coming to your body, and by 5 o'clock, you start having no more dreams. Dreams stop. You're going from the rabbit eye movement stage, you start waking up, coming back from death. Like we are almost in our book, the Quran says that I give you life every morning. Can't you appreciate that? Can't you be thankful that I give you a life every morning, and if I wish, I would have taken it when you sleep and you wouldn't have known that you have died. So I feel that way. When you look at somebody who sleeps, looks like dead. It doesn't nap. And then when you wake up in the morning, the first thing you have to say, thank God, that's my birthday today. Because that is the birthday. Birthday is not the day you were born. Birthday is when you wake up in the morning and you're feeling good. That's your birthday. You follow me or no? It is not the day that when you're young you get lots of gifts and you love it, and when you get old everybody has to remind you how old you are. No. That is depressing. It is a birthday. That's why we don't celebrate birthdays in Egypt. There's no such thing called birthday. No. There is no such thing. When you marry, you don't know how old is the other person. You don't ask questions about it. You like each other, you marry each other. There is no question asked. There is no, are you this, are you that, are you rich, are you that, or that. You look at each other, you like each other, you marry each other, you're going to function with each other. So the money and age and race and all of that is not a big factor in the choice. The big factor is the heart of the person himself. There's no time to celebrate birthdays. Why? Every morning they wake up, they say, thank God for giving me your life. Every day, every morning, thank God for giving you life. So there's a birthday every day. And then when you come here, I said, this is your birthday today. I said, oh, that's right. That's June 10th I was born. But what does it mean? It doesn't mean anything. Because every morning, every night, I die. Every morning, I come back alive. So my birthday is next day. This gland, when it wakes up at 5 in the morning, and you start getting the feeling in your body, the first thing that happens, the temperature starts going up from 96 to 97 to 98. The heart rate goes up from 55 to 60 to 65 to 70 to 75 to 80, hopefully. And then the intestine starts rumbling, and the skin starts getting warmer, getting more. In the night, it's cold. Then hopefully it gets warmer. It gets warmer. And the brain starts functioning, starts thinking. And the eyes start opening. And the hearing starts being acute. You listen to the alarm and so on and so on and so. And then by 7 o'clock or 8 o'clock or 9, you wake up. But if you force yourself to stay asleep, you will have headache. You will have a problem because that gland will tell you you're supposed to be awake. And then you get hot. And you have to get out of bed. That's normal. I said normal. Okay. So when I see a laugh, means that doesn't happen to me. Okay? So I said that's normal then. So these hormones right here, we don't want to make the lecture so complex. So what I'm trying to say, those hormones right here, when something goes wrong with them, you have a problem. For example, the TSH goes right here and stimulates a gland right here in the neck called the thyroid gland. And the thyroid gland, when it's working right, it gives you energy, it gives you heat, it keeps your weight slim, it prevents fat metabolism, it converts LDL to HDL. That is the thyroid gland function. So this gland right here, I think my pituitary gland is waking up. Like a lot. Okay. I know. I'm just saying, that according to the topic, this will be the case then. So this gland right here, I see lots of women have low thyroid. Low thyroid, you get cold because you don't have enough heat. You have poor circulation. You don't think clearly. You gain weight easy. You don't have enough muscle control, and so on. So this is one gland. We're not here to talk about thyroid tonight, but tonight we are going toward the ovaries and the female hormones specifically. But we have to pass by the thyroid to do that. But behind the thyroid gland, in the back of it, right here, there are glands very important for women. And we're going to show them right here. Those glands right here, which I don't think is showing, but let's use another color. Nothing shows on black, isn't it? Okay, whatever. There are glands in the back of it, right here, called what? The parathyroid gland. And that is the gland we're going to talk about tonight, about osteoporosis, how to prevent it, and the role of the parathyroid gland in calcium and alfalfa and Formula 1, how this gland works in that. We'll come back later on in a few minutes. There is another hormone, comes right here, called PTH, to stimulate the parathyroid gland. So you got that? We already covered that point. There is other hormones right here. There is a hormone called ACTH to stimulate another gland that sits over the kidney right here. I'm sure you know what it is, right? What's the name of it? The adrenal gland. And the adrenal gland is very important because the adrenal gland, from the name, it makes adrenaline, then you feel good. It makes cortisol steroid, natural DHEA, your own DHEA, it makes cortisol, that it makes you feel good, makes you happy, it makes you make more immune system, better immune system, and also you fight infection better with that. This gland is very important also to control the blood pressure, but also that gland secretes hormone in women called testosterone, male hormone. And that male hormone testosterone is what's responsible for keeping the women function of life very fit, very perfect. We will come back to that hormone later on and talk about that when we finish the cycle. The FSH and LH, they secrete estrogen and progesterone. They help that. When we talk about men lecture, FSH and LH also secrete testosterone hormone for the testicle to produce the sexual desire and the erection and the impotency and all of that comes also from the same hormone. But for men, it works different from women. It's the same hormone, but it goes to different glands. You know that, one from the other. So that's something we're going to repeat again in the next lecture. There are other hormones right here, and we're not going to go through all of them. We're just going to come down further here and say, underneath here, the women have two glands called the ovaries. They secrete estrogen and progesterone. So we are defining ourselves right now to a few things. Thyroid, testosterone from the adrenal glands, and estrogen and progesterone. Are you following me or not? We're just going to concentrate on those and leave everything outside of our concern right now. Because those, I have a reason behind that. Because those are the main major hormones. And those are the hormones that made me start research 15 years ago. 15 years ago, what made me interested in those hormones, estrogen, progesterone, is when I read in magazines, medical literature, that estrogen causes cancer. And I was a biochemist at that time, and I teach in medical school biochemistry, and I said, how could it be? Estrogen causes cancer. But the research said that. I mean, they saw the cancer from the estrogen, and they tell us that. In the meantime, I teach the opposite. We teach all of us, not only me. Every doctor in the world teaches that estrogen, it doesn't do that. But practicality, we see estrogen correlation in that. You follow me or no? So that created a confusion in my head. What's going on here? And the answer came to my belief inside. My belief inside that I don't think God's going to make us by mistake. They're going to make him here by mistake. So the foundation was there that we're not born by errors. We must be built right. Then I started thinking, the reason I said that, a girl who's 15 years of age or 17 years of age has tons of estrogen and she doesn't have cancer. Why didn't estrogen cause cancer? Are you following me or not following me? Just think about it. She has a lot more estrogen than anybody. 2,000 milligrams, 1,000 milligrams. We try to achieve 200 in women at the age of 60 to 70 and all of that. We try to, with difficulty. And when we try to achieve that, everybody says it's cancer. However, girls have a level of 500 to 1,000 and doesn't have any cancer. You understand that? The question mark right here. Which one is wrong then? You know, our research is wrong or God is wrong? Somebody is wrong. Because she has lots of estrogen without cancer and somebody said estrogen causes cancer. So that has to be answered. And I did the answer that time. Then I start thinking about there must be something else with the estrogen when it comes out to prevent the estrogen from causing cancer. Maybe. Then we find out that progesterone prevents the estrogen from causing cancer. Because if you get the estrogen alone, you can have cancer. If you have the progesterone with it, you don't have cancer. That is the answer was right there. That God put one hormone and put the opposite hormone with it. And men, it's the same thing. For men right here, have you heard about that? That testosterone hormone can cause cancer of the prostate. Has anybody heard that before, right? Well, boys at the age of 17 have tons of testosterone. They're chasing girls all day with their testosterone. Where is the cancer? We don't see any cancer in them. So we cannot blame it on testosterone. We have to think about something else. Could it be vitamin deficiency? Could it be antioxidant deficiency? Could it be other things rather than testosterone? So it is so easy in medicine to blame something for everything. To say cancer, genetic. Cancer, hereditary, your mother gave it to you. Then they wash their hand out of research. It's hereditary. And they have everyday genes. We discovered the gene of that, the gene of this. Baloney, this is all garbage talk. Because we know from chemistry that the DNA, the genes of DNA, can be altered by the chemicals in the environment. And that person they study could have been altered by the chemicals, the drinking, the alcohol, whatever he does. It doesn't mean that he was born like that. So this was not taken in consideration at all. And sometimes they say family have a history of that. Well, a family, because the whole family is screwed up family. They all have the same lifestyle. They all drink. They all do the same thing. They all have the same life. This is why. The father drinks, the son drinks, the son, they're all living the same life. This is why we see the same disease. Why don't we think about it that way? That the reason they are like that, because we see other families, they're all healthy. They're doing fine. And this family is not doing fine. Why? Then we have to think about the individual did something wrong. Not just say, oh, my mother gave it to me. We have to think. But there is something very important. It's not part of the lecture, but we discussed it in one of the lectures early in the past. That we have found that Harvard Medical School, they did research on that subject and that issue, and found that, I hope I find it here, didn't plan on that, that actually I should forget about that. I had them in order. Now they're not in order anymore. Okay. Anyway, what I try to really show you is something very interesting because it's going to give lots of faith and hope to lots of you if I find it right here. It is the chemistry of antioxidants. How can they reverse aging process? And then this scientist, I already said that in many lectures before, but lots of people didn't believe it, so I had to use Harvard as a backup for myself. So I said, well, see, Harvard said that. So the study itself was done at Harvard. Let's put this so you can get busy reading that until I find it. Okay. And then, here it is. Okay, see, when you pray, you get the results. Okay. So what happened here is the following. We talk about lots of chemistry, but forget about that. Take this away very fast. And this, right here, the issue is here. We were talking. Let me just put all this stuff on the side so I don't get off track here. The thing where I want to talk about right here is the following, that the reason we have problems, we have to think about our responsibility. Are we exposed to chemicals? We're harming ourselves. And then are we taking the supplement to get rid of it or not? That's the whole issue. And this is a big fight between the medical people and the nutritionists like us, like me. I say yes, environment causes this and this and this, and people don't need all these drugs. And if we pay attention to health and nutrition, we can solve the problem. They said, no, baloney, you're not going to do that. We have proved that estrogen causes cancer. This is cause this. We're not going to do that. So right here, they say that these chemicals, ETC, by the way, is magnetic right here. By the way, if you ask about magnet, that's what ETC stands for. The emission, transmission of magnets called ETC. So the people who have magnet, they have destroying the DNAs like that. These chemicals here, X-rays and all of these fumes and all of this, destroy what? And you know DNA, once you destroy it, you're in trouble because you're not going to produce good bone marrow. You're not going to produce good healthy skin. You're not going to produce anything. Everything ages when DNA dies. Are you following me or not? Because everything is built from DNA. And that will lead to aging, arteriosclerosis, and all of these things if you can read it. I don't know if it's focused or not. Well, just assume that you can read it. It says aging, arteriosclerosis, certain types, or take some beta-carotene maybe. That will help you. Okay. Anyway, but this here, this is diseases. This is just examples of the article. This is double-blind study. Believe me, this double-blind study involved 20,000 people. This was not a study of 20 versus 20. This is thousands of nurses, thousands of doctors. I was one of this study myself. I was part of one of the studies, physician study. Every physician in the country was involved in one of the studies. Then you get like we volunteer in the studies. Like they call us. They said, you want to volunteer for a study? I said, what you going to do? I said, we're going to try to check to see if vitamin E is beneficial or not. I said, what's your objective? We're going to give you for a certain time placebo or vitamin E and see what's the result. And then they give you, and you have to stick what they give you. You take only. You don't know if you get in sugar tablets or vitamin E for a period of a month or two, and they take blood samples and they analyze it, and then they pay you $50, and then you are happy. So these studies, the people who do it not for money, because they want to do it to help humanity. This study, the Finnish study from Finland, will involve thousands of people. The same study. In Chinese study will involve over 200,000 people. And the American study was involved thousands. So we're not talking here about small group University of Madison, Wisconsin study. We're talking about international studies. People who win Nobel Prizes. They work in Harvard Medical School on this topic. Are you following me or not? This is international research. And what I'm trying to say right here is this point right here. I hope I have something over here. I do. 99. It says right here that given antioxidants, vitamin C and E and beta-carotene, they noticed 99% of the DNA that's been destroyed was regenerated, rebuilt, became normal again. Have you ever? I never heard until I read the article. With my knowledge, I didn't know that. So you learn every day something. So when I read it, I was amazed. That the DNA can regenerate. I always had hope, because I see it in my patients. I see people with stroke recovering, heart problem recovering, cancer recovering. But I didn't know you can reverse aging. You can reverse cystic fibrosis. You can reverse Down syndrome. You can reverse those people. That's what DNA is all about. So the hope are there that using the proper nutrition and less chemicals, we can reverse the aging process. Are you following me? You finished with this page right here, everybody? Okay, good. So we can continue with the lecture now. So this hormone estrogen, progesterone, when I had that question in my mind, then I start selecting some of my patients and discussing it with them. I said to my patients, okay, you're not feeling good, let's check your hormones. So I check the thyroid, the progesterone, the estrogen, and the testosterone level and cortisol level and see what you are. If they have period, we check it before the period and after the period, and we find out the difference, the PMS curve, and I diagnosed PMS that time. And that time, we were given progesterone, which is nothing wrong with it. It doesn't cause any harm to anybody. It doesn't cause cancer, so no fear. We get tons of evening primrose oil and no problem. And women were feeling much better. Then we come to the estrogen, to the group that the estrogen was falling down like this. And I find out that women at the age of 50 have 99.99% of them have only 10% of the estrogen they're supposed to have. You follow me or not? Let me repeat that again. The normal estrogen level is between 400, about 400, and 99 had about 40 to 50. That's not enough because you need 400, you need 400. And in men, when we talk about the ratio, we discuss the same subject also. When I found that, and estrogen, we're going to be talking about it in a minute, the benefits of it, I told them about all the benefits the estrogen is doing. I said about the fear of cancer also. We discussed both possibilities. And I said, if I was a woman, at the age of your age, having this problem, going to develop all these diseases from lack of estrogen, even though say cancer, I will still take it. I will still take it. Because not taking it means you're going to lose tons of quality of life for the fear of something not proven. Then I said, well, how about cancer? I said, well, about cancer, we're going to do mammogram, we're going to do exams, we're going to do tumor markers, we do the best we can. That's a chance we have to take. You willing to do it or not? And 99% of my female patients said, yes, I do it. If you believe in it, I do it. Then we started giving estrogen, but we didn't know the dosage, how much exactly, because only God knows the accurate. So we started adjusting the level. We give too much, too little, too much, too little, too much, too little, because you're not God to control. This was controlled by here when they were younger. I know you might ask me a question, why we losing it? Why God make us losing it? No, God did not make us losing it. We lose it because we will talk about that during later on. The reason we lose the hormone function is because the pituitary gland gets exhausted from stress and chemicals through life, and then by the age of 50, there is nothing left. That is the reason. There is exhaustion, adrenal exhaustion, pituitary exhaustion, thyroid exhaustion, ovary exhaustion, and that affects everything, starts at the age of 35 and affects the woman relation with her husband, the woman feeling, and the relation with the kids, with the society, with everything. And nobody understands that person going through crisis, and nobody is listening. So if you say, I have a headache, I said, so what? The doctor say, well, it's just stress. Or I don't feel good, well, it's just in your head. And everybody wants to just give Zoloft or antidepressants and something like that. Whenever you think, okay, send them to psychiatrist. So that was the attitude then. You say PMS, psychiatrist. You say estrogen, you are over the hill. Or menopause. What menopause mean? What's this change of life? I didn't know life changes. I'm in a change of life. Change of what? It's a name that gets you depressed. You know? What's this change of life? No, we have to think about the body in a positive manner. Human body is well built to stay young. But we get in a problem because we're not taking care of the machine. And I showed you the research right there. I showed you this study already. Not only that, my patients themselves will testify to that. That they're doing better now than they did 10 years ago. So I start giving the estrogen and progesterone, we start seeing good results. Then, after about 10 years later, the research, the whole country started doing research on estrogen, and many doctors start giving estrogen. That's great, but they were giving synthetic estrogen, not natural estrogen. Not giving progesterone with estrogen, and not checking the blood level to see are the patient absorbing it or not. If you're going to take it, how do you know how much you have? You follow me or not? You got to have a data like diabetes. If you want to take insulin, you need to know what the blood sugar is, right or wrong? You're just going to take it without knowing. Same thing. You're taking hormone, you have to know what your level is so you can adjust it. So the people who are taking DHEA, how do they know how much testosterone they put in their body? How do they know they're not going to be like Alzedo, the football player who took so much DHEA, and he died from heart problem, right? That's what he's taking DHEA. So we have to be very careful when we take hormones without monitoring the hormones. So hormones are double-edged sword. They benefit you and they hurt you. What does estrogen do? To discuss estrogen, we have to look at several things. First of all, the bone. It's made of calcium and magnesium and minerals and produces red blood cells and white blood cells. In the meantime, how does the bone build the calcium? Just watch what happened here. The intestine, here's the stomach, here's the intestine. You consume from outside calcium. If you're taking calcium from outside, and you cannot take enough calcium through milk. You have to take extra calcium. You need about 2,000 milligrams of calcium a day. So you take calcium, and the calcium goes through your body without being absorbed. What you take from outside goes out. Only absorb if you need it. You understand or no? Your body only absorbs calcium only if you need it. So the people who say don't take too much calcium, you have kidney stones, you have that baloney. You know, there's no scientific back into that whatsoever. Calcium goes absorbed only when you need it. So taking tons of it is not going to hurt. It's not going to cause any problem. Deficiency of it, yes. That is the calcium, how it does. But let us look inside the body what the calcium does. The calcium, in every organ, it works. Every cell in the body, brain, heart, bone, intestine, calcium is the main ingredient of contractibility and function. You take calcium at night, you sleep better. You take calcium when you have a heart problem, when the heart stops, we use calcium, it comes back. Some of you are nurses. We know we give calcium chloride, calcium carbonate in the heart. When doing CPR, the heart comes back. When somebody's shaking, has tetany, hyperventilation, we give him calcium, they come back. Calcium, when it goes down, we die. For that reason, we have in our body a gland right here in the neck, in this area right here, in the two sides, called the carotid bodies, and they measure the amount of calcium with the parathyroid gland right here. They measure how much calcium you have inside your blood. Why did God put a special monitor for calcium and he did not put a special one for sodium or potassium or chloride? Only calcium. None for iron, none for magnesium, none for anything else. Only calcium. What do you think then calcium is so important then? There is a specialized organ for calcium. And this organ called the parathyroid hormone. And the parathyroid hormone, it sits right here inside the cell, like a guy sits right here with two hands. One hand's inside, one hand's outside in the blood. And he takes a sample of the blood and tastes it, and he said, the calcium is low. Once he had the calcium is low, he had a telephone or a fax machine. This is the old-fashioned telephone. I used to do in all the lectures. Now I have to do a fax machine like this. Okay. He had a fax machine, and he sent a message to many areas. First message to the brain. Tell the brain the calcium is low. Let the person know. So once the brain gets the message, immediately makes you go to sleep. The brain makes you tired, fatigued right away. Because no calcium, how are you going to function? You're going to be in danger. So the brain puts you down. Syncope or dizziness or whatever. In the meantime, it gives a message to the bone. Tell the bone, you have lots of calcium. If we need it, would you give us some? And gives a message to the intestine. The intestine have a doorman right here. His name is vitamin D. Came from alfalfa that you took with the calcium. And the vitamin D gets a message, open the door and allow the calcium to come in. And the person might have calcium, might not have calcium in his diet that day. And then send a message to the last organ, which is the kidney. Shut the door. Don't let any calcium out. See, these are the messages. This guy here, his name is 125 dicholecalciferol. I cannot write any further. I think the thing is over. Dicholecalciferol, that's vitamin D3. And this is vitamin D1. So vitamin D doesn't come from the sun. It comes from alfalfa. And people think vitamin D comes from the sun. If you say that, that's what Florida tell people. You know, we have, you know, they want to export vitamin D in sun containers with sunlight or something like that. There's a container that said vitamin D in it. It's a joke. You have to say that so people can laugh. So the calcium goes in because the alfalfa is there, the vitamin D is there. The kidney does its function because it closes the door. And then the calcium, no problem. Then this calcium from the bone doesn't come out. Doesn't assume then there is no calcium coming from the diet. Then what happens? The calcium will come out from where? From the bone. And we leave the bone with holes in it. And the holes in Latin called pores, and we call them bone porosis or osteoporosis. Means lack of calcium in the bone. And that is number one problem in women when they get older. It affects the bone to the point they start collapsing the discs and going forward, and the hips start being affected, they start getting shorter. Then the worst of all happens. What is the worst of all? They fall and break the hip. Then the doctor tries to put the pin, and there is nothing to glue to. Then she's in a wheelchair, she's in a nursing home, no exercise, then she dies. You visit that person, the brain is working perfect in nursing home, but the head is not. But eventually they go like this, they contract like that, and eventually, but they can hear, they can function. I used to talk to them all the time when I used to take care of nursing home patients. So this is the problem of having lack of calcium and vitamin D, and you don't have lack of parathyroid hormone. But when you reach the age of certain age, we find a problem here. The calcium, when it goes to the bone, it cannot enter the bone without estrogen and calcitonin hormone and thyroid hormone and all the hormones. The calcium cannot enter the bone without estrogen, thyroid, and calcitonin and many other hormones. Are you following me, or are you falling to sleep? Because many doctors telling the patient, if you're taking calcium and exercising, you don't have to worry about osteoporosis. There's no way you're going to have calcium enter the bone without estrogen, without the hormones. There's no way you can have sugar into the cell without insulin. There's no way. Insulin, without it, you have diabetes. No way. You can't. We know that about diabetes. Now I'm just making comparison studies so you can understand what I'm trying to say. So there's no way. You know, that's physiology. This is biochemistry. This is what's in the book. This is how estrogen works. That's how the bone works. So when we have these people, what we do for them, we do a blood test, and fortunately, all people over 65 who come to us do not have to pay a penny for any of the tests, because so far, Clinton administration did not change the policy. We have an agreement with a certain labs. They do all the tests for free. The patient doesn't pay anything unless they don't have supplemental insurance. They have to pay the 20% difference. But if they do, they don't pay anything. These people, we find they have very low estrogen, very low calcitonin, and then when we give them estrogen and calcitonin, 2-3 years later, all the calcium back to the bone, and the bone getting stronger, and the person is not getting any bad hips anymore. So 1 year, we have a bad bone. 2, 3 years later, it's perfect. Actually, I showed the patient the picture. Said, here's your X-ray 2, 3 years ago. Here's your X-ray now. Look at that. That's great, isn't it? To see yourself getting younger, getting better right there. And that's good hope, because when you take the hope from people, you over the hill, you change your life, there's nothing you can do, you this and this, then there's nothing to live for. And when you give hope that, yes, there is scientific evidence that we have, that we can reverse diseases, heart, cancer, this and this and this, by scientists, by me, by Harvard, by many good doctors, then we know that we have good hope. Not false hope, not quackery hope. It's a true scientific hope. So this is the cycle of estrogen to the bone. But the same thing happens with estrogen in the skin. We just discovered that lack of estrogen in the skin and progesterone, that's what causes wrinkles. Aging of the skin is hormonal related. As a matter of fact, we're reversing that right now. We have a new cream with hormones in it, we put in the face, that reverses the picture aging of the skin by 20 years without makeup at all. And that just came in the market recently. It's natural also. So there are good things for the future. Rather than having the makeup and the cover and the mask and all of that, you just walk like you coming out of the shower and just go out, you look just nice without anything. Because the tissue itself has more vitality, has more circulation. And also, by the way, men also use it. We use that on men and women, not only women. We use the same cream on men right now also. Not only, it's not for beauty or anything like that. It's to protect the skin. A healthy skin doesn't develop cancer. You follow me or no? That's what I worry about. It's not the looks. I just don't want melanoma in the skin. I don't want cancer in the skin. That's what I'm worried about. And that's how we treated cancer of the skin for years with a vitamin A cream. This stuff is, we use it right now. So that is what the hormone does. It prevents aging of the skin, estrogen and progesterone hormone. Look inside the body, the heart, the same thing. When you look inside the heart, you find out that the heart, this is the artery right here, and this is the heart. The cells of the arteries, they have, without estrogen, they have too much chemicals inside there. And when we give them the estrogen, the chemicals are out. So, lack of estrogen causes arteriosclerosis. So women with lack of hormone, estrogen, can develop high blood pressure. And this is why you see high blood pressure develop in women after the age of 50. And heart attacks, and osteoporosis, and aging, and all of these things. Right or wrong? You don't see a 25 years old girl with high blood pressure. As a doctor, we never see that. Why? Because God made them to be perfect. To be perfect in health. Because they have to produce somebody else. They have to be well-designed. You follow me or no? For that reason, we don't see diseases on them when they're young. Young girls we don't see disease, we see young boys. We don't see as much diabetes, we don't see as much this and that, because their hormones are working perfect. But when they get to go downhill, this is when we'll start seeing many problems start occurring, and that's when we come and should study and reverse the cycle. So is it true or not true that you see more high blood pressure and heart attacks in women when they get older? And that is the reason. This is not only my opinion. This is actually, there are, as a doctor, we get magazines paid by drug companies, so we don't have to pay for it. So we get magazines telling us how do we reverse aging, the research is done on that. We get something for women, research to see how estrogen can prevent this and that and that. So all these things comes from papers and study and scientific things now. In the older days, I was doing it on my own by myself without, but now, thank God, that other people do research. Not only the arteries gets younger, and the heart gets younger, and the bone gets younger, and the skin gets younger, also the vaginal mucosa in the vagina, when the estrogen is low, it gets dry. And a dry vagina will develop cancer, and infection, and prolapse, and urine incontinence, and the sphincter cannot close of the urine. Then the urine just leaks out. So that can be reversed, can be corrected the same way. We do that also. Put estrogen right here, and that will help this muscle, and the urine comes right here, will control that, and that will, both of them will improve in the same time. Then above that is the uterus. Uterus can have cancer. And uterus, when we give estrogen to women who do not have period, sometimes we see all this blood come out all at once. And that's a surprise, and the only surprise about it is it must be something wrong inside that uterus to bleed that heavy. And when we do ultrasound, we find fibroid tumors, we find old junk and debris for all these years sitting inside right there. And then that's what estrogen does. During the period, sloughs all the bad things out to clean the house for a baby to come. That's the reason everything goes out. So when a woman can say complaining, gee, you know, I used to have that period, I hated it, and all of this, now I have it again. So what? That's good. But nobody likes it. So we have to do something to cut it down to make them happy. But that's what happens when the uterus gets aged, it can develop also cancer. So this is all about estrogen we talked about, and about progesterone. There's one more thing. The brain. The brain also, we have noticed that the brain cells, this is the brain right here, this is the eye right here. The brain cells themselves, we have noticed that with lack of hormones, estrogen, they start dying. And when we give the estrogen, they start coming back alive again. And that is another thing we find, it prevents Alzheimer's. And actually there was an article I saw in one Chicago Tribune, actually right here, this is about 5 years ago, that came out. It says, how the brain keeps itself fit. Discovery of healing chemical offer new hope for treating Alzheimer and other diseases that steals our memory and reason. And down here it says estrogen and progesterone, testosterone. And the answer right there, and vitamin. So this information was hidden that you arrest people for in the older days. Now it's coming in newspaper and people know it, and then articles coming up to beat the clock. You know, that's the whole page. How it's Los Angeles Times. You know, anything I see in the paper when I read, I just cut it and put it right in there. It just show to the people that scientifically we have proofs, and non-scientifically also we have proofs, and testimony from your friends who are taking care of themselves, you'll have also proofs. Right or wrong? Ask your friends who take care of themselves. Take vitamins, take hormones, and exercise. See how well they're doing. And you will see the answer. Now we come to the last hormone of female hormones we're going to talk about tonight is testosterone. Why a woman, and that I discovered this only about 2 years ago. Why a woman needs testosterone? In the past, we only checked estrogen, progesterone, and thyroid. We never checked testosterone. Until 2 years ago, I started checking testosterone because I read about it. Then I find out that women, actually young women, even young women, they're supposed to have about 70 milligrams of testosterone in their blood, and lots of women have level of 25 or 30 or 15 in that level. Testosterone is a hormone responsible for muscle function. It builds muscles in men. Why does a woman then need the testosterone? Because it does keep her muscle firm. So when she carries that baby, it doesn't fall off. So you need that firmness, and when the baby comes out, it goes back in place like it was before without any stretch marks. So that's what testosterone does. Testosterone keeps the skin from getting flabby all over. That's testosterone. Testosterone also helps the estrogen in the bone. That's testosterone. But the most important thing of testosterone, androgen hormone, and that's why DHEA became popular. Actually, that's the reason this became popular. That's the testosterone also. Is the testosterone is an androgen hormone that's responsible for sexual desires and function. It is the only hormone in women make her want to have relationship with her husband. Is testosterone. If it's absent, there is no desire. If we take the same woman, same person, who hates her husband, want to divorce from him because of that, and then we give her testosterone that day, and bring it to 90, all of a sudden all family problems are gone. And she comes back very happy. To the point, I had one patient tell me, she said, don't give me any more testosterone. I didn't have a husband, I didn't have a boyfriend, I didn't have nobody, and I didn't need that stuff. And she was 80 years old. Seriously. And I said, that's not my problem, but don't look at me. You know, solve all problems. So that is testosterone. So we start to give in testosterone, and everything you do, you always get questions. And I have to be open to listen to this complaint. Like when you give estrogen, you hear this about my breast is tender, my period this. The reason all of changes is because your body's getting younger. The breast is tender because it's building new tissue with milk ducts. So the aging is being reversed. That's why. And in the desert in Egypt, there are women at the age of 60 and 70 who specialize in giving milk to babies. You pay them to feed babies. And they are 70 years of age. And they're producing milk. You pay them for a child, for every feeding. If the mother is sick, she has a disease, she went to that woman to feed her child because she doesn't want the child. They believe mother milk is the best. So they feed her very well, they pay her very well, and then she feeds those, and those we call here wet mothers. Over there, the same thing is all over the world. Why? Why is this? And that'll give you a point right here. I'd like to mention something about 2 points as long as we're talking about milk. This is why when people ask me question about milk, when I came to this country about 30 years ago, 28 years ago, I said, I do not think a cow will give her baby milk that causes heart disease. I do not believe so. So I do not believe the milk is harmful. I do not believe the fat in milk is harmful. I do not believe the cholesterol milk is even harmful as a scientist. But as a physician, I read about it, it causes problems. You follow me? You get this study, Framingham study, and said, yes, it does cause problems, blocked arteries. Then you get the scientific knowledge you have from your physiology and biochemistry, it doesn't. Then you get confusion in your mind, which way I go. Then you go back to nature again. Look at the people in India, in Amazon, in Africa, who are breastfeeding all the time, gallons of milk, drinking, and you analyze it, no hardening of the artery at all. My dad you drink a glass of butter every day. Butter in the village. Every day. When I brought him here, because he had a bad valve from rheumatic fever, and I heard he was having difficulty breathing from the valve. Then I brought him to St. Luke's in Milwaukee right here. And then anyway, it's a long story. They almost killed him there anyway. They made many mistakes. Every mistake in the world you can imagine they make with the man. To make a long story short, they operated in the heart finally. After I told them we got to do surgery right away. They said no, after Christmas, the doctor on vacation, and then finally the valve just blew up one night, and then they operated on him that night to put the valve, rather than 10 days earlier when I discovered it. Because I saw the leaking around it when he came on the 18th of December. And then I sent him to the hospital 19th, supposed to be the surgery right away. About Christmas Day, they said, no, we're not going to operate on Christmas Day. You know, we do it next day. And then the next day, they said the doctor went skiing. Then his assistant did the surgery. And then when they put the new valve anyway, and he was in a coma, we found all the arteries are clear. And that shows us these people lived in all these countries. Well, they have something we can learn from. We cannot just say milk is harmful. Milk is, I don't think it's harmful at all. If you add hormones to it, yes. If you add chemicals to it, yes. But milk, I don't think it is harmful. As a matter of fact, this is my opinion, and that's what I recommend to people, to drink milk all the time. And just recently, about a month ago, a new study came out that women who drink whole milk, their life have less breast cancer. And women who drink skim milk have more breast cancer. So here's a complex study now. Fat can cause cancer, fat in milk prevent cancer. So we have to think about it, that the breast filters out probably all the bad fat, where the meat keeps the bad fat. And the breast filters all the chemicals, where the meat keeps all the chemicals in the fat. Are you following me or not? And that's probably the answer right there. That the fat itself is really not the bad one. It's the chemical in the fat is the bad one. That's probably what we will discover in the future. That fat itself is not bad, but the chemical in the fat is what's bad. Because you can exercise almost any fat out of the body. The other thing I want to mention about eggs, this has nothing to do with lecture. Again, I do not think that a chicken will produce an egg going to become a baby, new baby that's be harmful for us. And now they're finding out there's nothing wrong with eggs. My patients for years, I never stopped a patient from eating eggs with high cholesterol or drinking whole milk. And their cholesterol stays down without medication. Because the reason the cholesterol goes up and the salt goes up and the blood pressure goes up is the lack of calcium and lack of minerals, and poor nutrition was not the salt, was not the fat, was not the cholesterol. Was nutrition is the answer. And these people from Harvard have proved that already when they did the research right here on coronary artery disease, antioxidants right here, they proved that in the last Dr. Michael Gaziano, which he's a professor in Harvard Medical School. They proved it also over there. So we know for a fact that these hormones are important and they have to be measured, and we have to adjust the level to the person's age. If you are menstruating, it's difficult because we have to do it twice, with a period and without period, and compare. And if you're not menstruating, that's easy. And if you are over 65, you don't have to pay for it. Under 65, your insurance will pay for it. Because no insurance company deny paying for blood tests for these things anymore. Because they know the benefit of it. Now, I'm going to take some questions from you. And I will say that the next lecture is going to be just as important as this lecture right here. We will cover male problems in general, hormonal problem, and heart problem, and skin problem, and mental problem, and all kinds of problems that affect men, include prostate and all of these things. I left some cards outside the door of my business cards if you have a question and you didn't get a chance to be the question to be answered, my number is there, and I also write it for you. It's 847-356-9009. My name is Dr. Nasr in the ASR. Now I'm gonna, is anything, yes? The best calcium in the market I found to be exactly calcium magnesium. In the market, yes. And by the way, a patient of mine, used to be a patient of mine called Joyce, about in January, telling her the reason I'm giving this lecture is because I give her kickbacks from my patients, and she gives me free vitamins and all these things. And this kind of accusation is just low mental thinking, because there are some people who cannot think that somebody have heart like her to go out and give something for public. If she wants to make money, she can do a better job making money someplace else that doesn't have a lecture or being even Shackley. Shackley is the worst business to get in to make money, but it is the best business to be in to make some money and help people. So if your goal is money alone, then go become a used car salesman. If your goal is happiness and health and family, this is the kind of business you stay in. Like doctors. I'm a cardiologist. I used to do surgery. You get $4,000 or $5,000 for half an hour of surgery. Now I can work a whole week for that. Why do I change from one field to another field? It's satisfaction. It's just happiness. It's one job, you make lots of money and you're unhappy, you're miserable. You know that you're hurting somebody. You know you're not happy. You know you're not doing good. And the other, you're laughing, you're giggling with your patient, you're having a good time, and that is what life is about, to be happy, to feel good. And that's what I have in my office among my patients. It's just like a party. We do a good job, but in the meantime, there is like a family feeling, which I enjoy. So this is why I give my home number to my patients when they need it. You ask them anytime. They want a home number, I give it to them. When I go on vacation, even I give them my number also. Because they don't bother me. I rather get bothered when I'm on vacation that they're not feeling good, because very seldom they even call me. As a matter of fact, many of them feeling bad and they don't call. And I wish they would. And I call them back from my vacation, tell them, are you okay? Are you doing fine? So that's what preventive medicine is all about. It is about this type. So the reason I said that is because I'm entitled to say these things. I'm entitled as a physician with my license to say that Zoloft, for example, is better than Elavil, or Prozac is worse than Zoloft, or Paxil. I'm entitled to select my own drug. I'm also entitled to select my own brand of vitamin. I don't sell it. I don't buy it. I mean, I buy it, but I don't sell it. I'm not a distributor. And I don't give it my clinic to patients. So I try to wash my hand out of it completely. That, my opinion, is what I told the gentleman in the back. It is the best calcium because I've seen the best results. Because among my patients, there are groups, there are 20,000. The people who take Shackley, the people who take other vitamins. The one who takes Shackley, they look healthier, they do better than the others. And then, among the others, the one who take vitamins in general, better than the one who not taking any vitamins at all. Are you following me or not? And the one who not taking anything at all are the worst of all. So I can see the three classes in front of me. Somebody would say, oh, it's more expensive. There's something cheaper. Or some other product in the market does. Be careful with any product in the market that comes out, it tells you it does something. If you see any book or any product says, our product gives you memory, our product gives you energy, our product gives you this, gives you that, be careful with that, because it could be a trick to get you to buy the product or the book. You understand? For money, anybody can write anything. I would take some questions, yes.
Is there a difference in functions between estrogen and progesterone?
In the functions, yes. Progesterone, estrogen, it keeps you young. Progesterone, in the opposite, that is the feeling happiness. It comes from just give you the general well-being, feeling good. That's progesterone does that. It doesn't have any other function we know of right now. But also we notice that estrogen without progesterone can cause cancer, and with progesterone it does not. So that's maybe another benefit also. Another thing we're finding out about progesterone, when we give it to men with bald head, they grow more hair in a cream form. This is research underway that lack of progesterone in men also causes baldness. So there are lots of things about hormone I don't know yet. We are researching that. Any question in the front row? Yes.
Yeah, I had a liver transplant 3 years ago, and I've been taking supplements, and everything is great. I'm doing really well. I'm on the minimum dosage of
Chemotherapy?
no.
Yeah, that's chemotherapy, yeah.
And but he doesn't mind the supplement, but he's horribly against any kind of a hormone situation in taking it.
Well, first of all, you're a man, and he's right. If you're going to take a hormone as a man, you're going to have to know a reason why you're taking it, because a hormone is a double-edged sword. It can help you, it can hurt you. So I do agree with your doctor that he's worried about it, about hormones, because when it comes to men, we have to be very selective which hormone to give and how much to give, because they really don't need a lot, and they can get in trouble easy. You know, that's the problem with men.
If the supplements I'm taking, you know, I have to keep my immune system suppressed, right?
Yes.
Otherwise, my liver will reject. The supplements won't interfere with that. I mean, it won't get my immune system up too high.
No, I hope it gets up too high. No. Actually, the rejection probably is very minimal possibility for you right now, and you have to continue to take the chemotherapy for it. Supplement has nothing to do with, supplement is like water, like oxygen. It goes in. If it's empty cup, it's going to fill it, and when it's full, it goes out. That's what supplement does. Without it, you're in trouble. With it, you're never in trouble. And I never seen a vitamin problem in my life. And I lectured to millions, and I treated thousands. So I don't believe you're going to have any problems. Yes.
Pituitary adenoma, you're given a medicine to regulate the system.
Mm-hmm.
Take something else other than that?
The question is pituitary tumors, where they destroy a pituitary gland. That's what you're talking about, right? With radiation or surgery, correct? And you have to take a pituitary replacement hormone. There's no problem with that. You can take any supplement, and you have to take the medicine. Yeah, that's you have to do that. Yes.
Would you recommend a separate protein for a regulator of your hormones?
Well, actually, I put a sheet in the front in the beginning of the lecture right there. This is what I recommend to all patients. The protein was one of them. Anytime you give vegetable protein, it's easier in the body than animal protein. So given 3, 4, 6 tablespoons a day of instant protein is a lot better than hamburger. So, and protein is important, yes. It is very important to regulate your body, yes. Yes. Okay, that's a very good question. I'm glad you mentioned that. I forgot about that. If you have cancer of the breast, we will not give the estrogen hormone. Not because estrogen hormone causes cancer, is because the fear we don't have enough data. And cancer is there, it's a killer. So we rather have the patient suffer from aging of the bone and the skin and the heart and all of that for 2 to 3 years. My cancer patients, they take estrogen hormone now. But the first 3, 4 years, when we discover the cancer, I hold the hormones for 3 years. And if there is no cancer showing anything, we introduce the hormone slowly, and then after 5 years, we will go full-blown, and then the cancer does not come back again. But you're right. It is because the fear of it, like prostate cancer, still the same thing. Even me, with prostate cancer, I hold the testosterone hormone, where urologist, I know, he gives it, and he doesn't think it's right to hold it, even if it does cause cancer. He said, no, he doesn't believe that, and he's going to give it. So one urologist disagreed with me, and he gave the testosterone to cancer patients. And he was right. The cancer cells actually went down, didn't go up. So we have not done research to give estrogen to cancer patients. However, it is known that when there's a cancer of the breast, estrogen can make the cancer grow faster if there is cancer in the breast, and we have to avoid it. Yes? Natural estrogen exists in many vegetables. In alfalfa, you have natural estrogen. In yams, you have natural estrogen. In potatoes, you have natural estrogen. But it's not enough to give your blood level up. It's not enough. You have to take estrogen from outside. So companies like Abbott Laboratories and stuff like that, they have made estrogen natural, and Premarin is a synthetic one, and there are natural estrogens, yes. And the patch is not one of them. It's a synthetic. Yes.
So if a person has had breast cancer, should they not take alpha?
No, they can take, because that's a good question. That actually a question needs research. You're right. Here we have a cancer patient. We tell them don't take estrogen. But in the meantime, we never tell them don't eat salad, don't eat vegetables, don't eat yams. And they have lots of estrogen. So you're right about that. That's something it never been studied. So the question is, does really estrogen have anything to do with it or not? And we don't have enough data on that. Yes, ma'am.
One was about the estrogen replacement therapy. Most of the women in this country, that needed to take it, are white females. What about third world countries? What about your village people?
Okay, that's a very good thing. They don't take estrogen, and we have seen something there. I think the problem here, we don't have enough time to cover the effects of the stress in life on the hypothalamus gland and secretion of melatonin that controls the functions of the body. And you cannot take melatonin from outside. You have to produce it yourself. And that's something probably related to the way we live, because the more modern societies, the more cancer, heart disease, hormonal problem. The other societies, you see women in the 60s and they still getting pregnant, and then they don't have osteoporosis, they don't have this. Maybe because they're eating more they're too poor to eat meat, and they eat lots of vegetables and lots of potatoes and lots of the stuff that it has more estrogen in it. That could be the case. Okay. Yes.
Could you talk more specifically what natural estrogen and progesterone would you recommend?
Which brand do you mean? Okay. Estrotest is a natural, Ogen is natural, Premarin is synthetic. All progesterone products in the market are synthetic, except evening primrose oil, which is not made yet. There are some companies making natural progesterone right now, but they're not popular yet. The questions in the back, yes. Candida? What? Kidney disease. Oh, kidney disease. No, if there is a kidney disease, yes, the kidney disease patient, my professor I was trained under, Dr. Robert Murky from Rush Medical College, where I was graduate from, he was the father of nephrology in the world. So I was trained under the best kidney specialist in the world, Robert Murky. He has Alzheimer's disease right now. I called him about 6 months ago, and he wouldn't recognize me. I didn't know that. But anyway, yes, we have to be careful, but still, my kidney patients, we measure the amount of protein in the blood, and we bring it up to the level it's supposed to be, and they can take vegetables, no problem. Yes, no problem. Actually, it's better for them than animal protein. It's better for them than animal. There's no really reason not to have vegetable protein. There is no study saying beans are bad for kidney patients, where meat is better. No study like that ever been done. Because amino acids are amino acids. But for kidney patient, because kidney suffers from protein. Protein is quite stressful on the kidney, so we have to be careful with the protein. But if you have nephrotic syndrome, and you're releasing 2,000 milligrams a day, or you're losing so much protein, you're going to swell like a balloon unless you give you more protein. So we have to be sure the protein level doesn't fall to the dangerous level. Yes. Progesterone as an aches, headaches. Well, all the hormones can cause headaches. Hormones in general, if you have migraine headache and you have lack of estrogen, and we give you estrogen, your headache can get worse. Your migraine can get worse. And this is why it's a very, very difficult subject. Headaches, if it's a migraine, it's an autoimmune disease. And the estrogen is natural. It attacks the autoimmune disease. In the meantime, it tries to correct the problem, and it causes more the opposite of what autoimmune disease does, so the headache sometimes gets worse. But we can work around it. I haven't seen that in my practice, that progesterone can cause more headache. I don't think it was depression at all. I haven't seen it because I don't have many depressed patients. So that's I don't see that. We're gonna go in the back right there. Yes. You can take. No, you can take it, but I think you have to have a blood level to measure the amount, and then be sure that your level is normal. Yes. Yes.
Okay, if a woman has estrogen dominant and no progesterone, what do you recommend that she take?
Both. I always recommend both, even if she had hysterectomy.
Okay, so even if her estrogen comes way high and she has no progesterone.
Oh, no. That's a different story. That's a problem in the pituitary gland then. That's FSH problem. I misunderstood the question. If the estrogen is so high and the progesterone is low, you mean? That's a problem not from the ovary at all. That's a problem from the pituitary itself. Gland is not from the ovary. The ovary has nothing to do with that. Now, we recommend that probably not to worry about it. Probably the body is going through a cycle. It's going to correct itself eventually. I think it will not last like that for more than 2 months. It will bring the estrogen down and progesterone up eventually. It cannot continue like that. It's impossible for the hypothalamus to continue secreting FSH without LH. Even adenoma, she was talking about, will not even cause that. Because if it's adenoma, both FSH and LH both going to go down, not just one. So it is very difficult to select one cell from another cell inside the pituitary gland. So I would say that that's the problem. Is not serious to worry about. We go all the way, just 1 second, all the way in the back, yes. Yeah, you. Okay. All right. Anything synthetic, I have some fear about. Okay, that's the way. I do not trust synthetics. That's the way. That's my answer to the question. So anything natural. If natural comes with synthetic, I prefer having natural. If there is no other hormone except synthetic, then I prescribe synthetic. You understand? But if there is, I said, I said it before. The ester test and Ogen are natural sources, primarily synthetic hormones. You had a question before. Just 1 second. Yes.
What about our GLA? Is that much better than even the rose oil?
GLA is actually has more progesterone than evening primrose oil. Yes. Yes, ma'am.
How do you feel about the estrogen and progesterone that are in birth control pills?
I don't recommend birth control pills at all. So I really didn't. We talk about synthetic. That's what her question was. I don't really recommend it. I have, out of 20,000 patients, I had 1 or 2 patients I had to use birth control pills on them to produce ovulation and to produce cycle because they want to get pregnant and the time was running out and we had to do something and the best thing was birth control for that time. But that's 2 out of 20,000. So I do not recommend that birth control pills. No, because it's synthetic. Because the study has shown synthetic hormone can cause cancer. And most of the study was done on synthetic hormones anyway. There's nobody that done a study on natural hormones. Yes.
Then with thyroid medication, is there an alternative to synthetic?
Synthroid has been shown the synthetic. We are out of estrogen now to another hormone. There are synthetic hormones are just as good as natural, and you have to understand that and we have to be fair in science, and synthetic synthroid is just as good as armor thyroid, equal exactly in function. But right now we're having difficulty with thyroid in general. Through the whole research program, we're discovering that all our data, our lab methodology was wrong, and we're measuring the wrong stuff. We're in trouble with the thyroid right now because we always tell the people, if your blood test is this, you don't need it, you need it, and the patient says, yes, I need it. We tell them, no, you don't need it, and we don't listen to the patient. I do listen to them, I give it to them, and they say they need it, but the blood test is normal, I still give it, but now it's showing that the blood test was inaccurate to start with, and then they went from T3 to 4 to TSH, and now TSH is becoming inaccurate. Now that we're saying there's a special kind of T3, maybe. So a lot just to say, let us give some synthroid or armor thyroid in a small quantity like 0.05 and just stay safe, and ask the patient, how do you feel, and do a blood level and just stick with it that way. Because when you deal with the human health, a patient with human health, you have to think how I feel about this patient. There is no time for experimentation. Every day I wait longer, something can happen to that person. And every day passes, that person is miserable, or having headache, or having problems, or the cancer is spreading. I worry about it. Like, for example, if I discover a cancer tonight, the patient got the report, I have to reach the patient tonight. I have to arrange for surgery tomorrow. I have to do it within 24 hours. I don't wait. And I hear about doctors even wait 2-3 weeks before they take care of the cancer patient. And that's dangerous. So same thing with hormones. You discover a hormone problem, correct it right away. Don't wait until next week or the week after, because that person can pay the price for it. And that's in a way, some way or the other. So hormones are something, it's very dangerous to have them too high, too low, and we have to work with it that way. The questions right here, the women ask what's natural and all of that. I want to tell you this. I have lots of patients. We give them natural hormones, and we measure the blood level, and it's still low. They don't absorb it. I have some patients don't even absorb the natural hormone, and they're still very low. And we have to give them injections once a month. So everybody is different. I think that's it for the lecture tonight, and thank you very much, and I'll see you next time.
Let's see if I can use that one. Is that the house mic?
Yeah. Before everybody runs away,